previous conception of Eastern medicine that I had is basically I didn't understand it. And it's always been viewed by Western medicine that it was somewhat substandard.
My skepticism comes from my culture.
But how can needles cause a cure and not cause a problem?
And that's why I tried everything before going to Oriental or Eastern medicine.
The people that our physicians see that have chronic pain are not the most desirable patients. Physicians are trained to fix things quickly if they can, and when a patient pain continues, it becomes very frustrating. This is why so many patients that have chronic pain get dependent upon chemicals of some sort.
Vicodin, Tramadol, Toradol, all the kinds of, for 2 years, and with no luck.
It's unfortunate that the patient doesn't come in right away and has to spend 2 years in pain. We're taking pain medications. And that's the frustrating part about medicine, because some physicians who don't know Eastern medicine or don't know about osteopathic medicine are treating these patients, and they're frustrated too because the patient never gets better.
Once that physician gets frustrated with all the treatment options, like the gentleman that was just here, PT, this, he's gone everywhere. You know what? They'll want to get help and get these patients out of their practice. I'm going to be honest with you.
A neurosurgeon, he said, there's nothing we can do for you. It's too risky to do the surgery due to the other medical condition that I had.
Western medicines, pain relievers, as well as procedures certainly don't cure everybody.
Years ago, and when I visited Korea, patients coming in with severe back and leg pain are able to get up from the table with some acupuncture. It's absolutely amazing. It's not just one patient, it was probably 10, 15 patients, the same result.
So if we can use acupuncture or trinotherapy or other methods of relieving that pain, it would be better for all of us.
It's improving. I have not had a headache all week, which has been the longest without a headache since before my surgery.
It's the most effective treatment I've had, and I've spent so much time and so much money going to other places.
We think the Jasin is the real deal, and that's why we think we're going to be successful this time. They are trained in Korea and here. They are certified in Korea and in the United States.
Even with the great medical advances that we have, there's still limitations in treating the human body. That exposes another type of therapy that can help, and certainly getting the human body to help heal itself is probably one of the most powerful mechanisms. It's certainly recognized in Western medicine, it's just how do we tap into that? And I think integrating more Asian traditional types of therapies certainly allow us to tap into that further. And I think there's also a huge patient demand who is really looking at traditional Western medicine and saying, is this all that we have? Is there something that we can do better?